That also answers my question on what would be required to make sure that mental health is actually considered in all different policy discussions and policy making itself, regardless of the specific topic. Catherine, do you agree with these priorities, and is this kind of the same understanding that you have of a comprehensive approach to mental health?
Yeah, I suppose one of the things that struck me when I was asked to do today, and I'm delighted to be here for Mental Health Europe and for the member organisations, was the spotlight that the pandemic put on mental health. And not only the spotlight it put on mental health, but a spotlight it put on mental health for all of us, individuals, families, communities, governments. Now is the time to match that with the commitment, with engagement, and with investment. And that's from all stakeholders. You know, it's not anyone's business, it's everyone's business. So in relation to that, the comprehensive approach is really very ambitious, but it's the right step in the right direction. So in Mental Health Europe, when we looked at this ourselves, we decided to do a multi-annual strategy. We have 6 key priority areas, and those priority areas match what's in the comprehensive approach. That's always a good sign. And from that, we would be looking to use the 70 organisations, plus the individual members, plus the partnerships and relationships that we have across the 33 countries and internationally, to support the continued work that the EU are trying to do in relation to implementing this strategy. And we're best placed to do that. From a Mental Health Europe perspective, we also currently lead on the mental health and all policies, which is stated in the EU Comprehensive Approach, and that's on the Health Policy Platform. This allows us to continue to get the cooperation of all the stakeholders and to set the trajectory or that journey in relation to mapping out where to next. The destination can only be achieved through the determination of co-creation and working together. The other piece that I would like to address in relation to how we're fulfilling this in Mental Health Europe would be how we want to change the perception of mental health. Yeah. Moving away from a kind of a strictly biomedical approach to a more integrated approach of psychosocial and recovery. And recovery is such a powerful word for anyone who's experiencing a mental health challenge, but to also address the socio-economic and environmental factors that are the determinants of mental health. In Mental Health Europe, we also, on every May, on the month of May for the European Mental Health Awareness Week, we host a pan-European initiative. And that aims to highlight the awareness of mental health in all our lives, every single person's lives. It's only through the narrative and changing that narrative around mental health that we can begin to break that stigma down. And it's not just the stigma that's external, it's the self-stigma that we experience when we have mental health difficulties or mental health problems or illness, whatever you choose to name it. But in relation to that, then we can also fight the discrimination that's out there. And this is one of the flagship initiatives of the European Union's communication. Lastly, but most importantly, is that since its inception almost 40 years ago, Mental Health Europe have been a champion in relation to human rights. It has championed that for people who experience mental health challenges and people with psychosocial difficulties. Today, the theme is around mental health as a universal human right, not just as a human right, a universal human right. And as such, and I think Lady Valenska mentioned it, it's not one day. This should be every day. There is no health without mental health. And I think that if we listen to that and put that front and foremost in front of everything we do, then we will be able to address it through the EU and through our member states, that we ensure that the mental health systems become more compliant with human rights, become more recovery focused, and view mental health as a positive and as a strength, not as a weakness. Thank you.
Absolutely. Sorry, the suit.
Good morning, everyone. My name is Irfan Lone. I'm a global health specialist and a psycho-oncologist. I'm really happy that, Madam Catherine, you touched upon very important aspects of mental health, which are not being considered as just one framework, but a broader, a huge framework. And it's mental health, so it's ecological. So you touched upon various things so my question to you is that because you discuss so many variants of mental health and so many dimensions of it, as Europe, because we are driven in Europe and we also inspire other states proudly, I must say, are we talking about health in all policies and a Europe which must invest into these policies to see that shining light in future where mental health and all the other aspects of health are actually on the mainstream of healthcare in a broader perspective? Thank you so much.
Thank you. If we look at mental health and think about, and I think it was Her Majesty mentioned it, there is no health without mental health. So I think having mental health proofed across all policies, and what I would be suggesting with a multi-annual strategy is that it's cross-departmental and cross-sectoral, but cross-country as well. Now, we have good examples, and I know that we have the portal there that's going to gather those examples of good practice. But it's one thing to gather it, it's another thing to communicate it. I think if we could also look, once you have a multi-annual strategy, we have to start with, okay, where do we want to be in 5 years' time? What do we want Europe to look like? And then start there and work back. And then each year set targets for ourselves. But it shouldn't be the responsibility of health on its own. It shouldn't be the responsibility of governments on their own. We all have a part to play. Every single one of us has a part to play in making sure that mental health is given priority. I look at the youth today, and I'm concerned that the focus is always on the negative. It's always on what's happening to the youth of mental health, but not about the resilience that young people, the strength, with young people there's vibrancy, there's energy. How are we capturing that? How are we utilising that? And that's why I think that if we just change the focus. Somebody mentioned this morning, I think it might have been Stella mentioned around the looking at protective factors. Well, if we focus on changing the narrative to being strengths-based and pulling on that as opposed to always seeing what's wrong, and even somebody who experiences mental health challenges or problems, when you go into a service, they say, what's wrong with you? It isn't what's wrong with you, it's what's happened to you. And then what can we do? How have you survived up to now? What have you in your toolbox? Because there's something there, because you are still here with us. This is where we need to have the voice of lived experience contributing equally to everything we do, and also the family members. And we've gone through this piece of GDPR out the door, but we really do have to look at confidentiality. And if somebody is living with family members or supporters, they provide very solid structures and information, but also can contribute to ensuring that the services that we develop are the services that people want. You mentioned it, we just did a survey in Ireland as well, and 49% of young people said the services, when they do manage to get one, they're not what they want and they're not what they need. So we need to stop wasting resources and we need to start listening, and people need to feel heard around it. I hope that went some way to answering your question.
Perfect.
I'm Sarah Copsey from the European Agency for Safety and Health at Work. So within this comprehensive approach, of course, I'm really pleased that so many today have mentioned the importance of mental health at work and the prevention of psychosocial risks at work, because over a quarter of workers report that work can causes them stress, anxiety or depression, and over 44% reported that during the COVID pandemic, their stress at work increased. So my question is probably more to Catherine and Natalia, but also if there's comments from Sarah. From the point of view of your own organisations, what would be the priorities regarding workplace, preventing risks at work and promoting mental health at work? And what would you see as the challenges from the perspectives of your organisations? Thank you.
Catherine, you want
Was
to
me?
first?
Sorry.
Quickly, both of you.
Yeah, mental health in the workplace is one of the key areas that is being addressed through Mental Health Europe with its organisations and members. And also at home in Ireland, where I'm from today, we're actually launching an online toolkit to support workplaces in developing their policies. Now, they call it health and safety at work, but I think we need to start with looking at the value that each member of the workforce places. So again, in what we're doing, we're looking at not coming in there with workshops and with toolkits that are there for managers. Every single person in an organisation in the workplace matters. So if we want to change the narrative in workplace, we have to do it with all the workforce, with the employees, with the employers working together, and co-create the strategies that will help to ensure that people are safe at work from a physical and mental health perspective. And what we're doing is we have a toolkit that will support that, and the online module that will support employers and employees to begin to address that. But again, we do need to look at, the new legislation on the right to disconnect. We do need to look at the working from home. It was at a time during COVID, it was really, really important. But I think what we're seeing now is that it is having an impact, a detrimental impact on people's mental health because of that isolation and that loneliness and that lack of support that you have from your colleagues and that lack of having somewhere to go to when you are having a tough day. We also have to normalise, and it's not just about people who experience mental health challenges, but you think of in the workplace, when somebody comes back who's had a heart attack, somebody comes back who's been diagnosed with diabetes, all the things that need to be in place are in place. When I talk to managers in the workplace and they say, well, what do I say when someone comes back who's had a mental health challenge and they've been out sick? I said, well, why would you treat them any differently to the person who's had a bypass or the person who has had cancer or the person who has diabetes? It's the very same. You sit, you listen, you hear what the person has to say, and you make the recommendations that need to happen for that person the same way as you would if anyone has a physical health challenge.
Absolutely.